welcome to the Deep Dive. Today, we're going to be stepping into the world of healthcare, and specifically the looming physician shortage in the U.S. And to help us kind of wrap our heads around this whole complex issue, we're going to try to use like this insider baseball analogy. So think of the U.S. healthcare system as like a baseball team, with physicians as our star players.
Yeah, I think it's a pretty fitting analogy, really, because just like, in baseball, a well-functioning healthcare system, it needs all its players to be in tip-top shape to really succeed.
Right. And we've got a whole stack of sources here. We've got reports from the American Medical Association. We got articles from all these different healthcare news sites, and even a couple of YouTube channels just to kind of get, different perspectives on the game.
Yeah, and I think it's important to get that well-rounded view, especially when you're dealing with something as, complex and as multifaceted as this.
So let's just start by taking a look at the scoreboard. I mean, how bad is this shortage really?
Well, I mean, the numbers they're pretty alarming. The AAMC, the Association of American Medical Colleges, they're projecting we could be short anywhere from 37,000 to over 100,000 physicians in the next decade.
Whoa, that's a lot.
Yeah. And by 2036, that number could jump to, a deficit of 13,500 to a staggering 86,000 physicians.
Wow. I mean, those numbers are way off base. It's like starting the season with half your roster missing.
Exactly. And to make matters even worse, this problem isn't just something that's coming down the road, It's here, it's happening now, and it's already impacting patient care. We're seeing, much longer wait times to get appointments, especially for specialists. And then rural communities are getting hit particularly hard. They're facing what some are calling medical deserts. These are areas that just have very limited access to any kind of healthcare, let alone specialists.
So it's like those rural areas, they're stuck with these like minor league teams while the big cities get all the all-stars.
Yeah, that's a good way to put it.
And it's not just specialists, right? I've heard that primary care is taking a hit too.
Oh, absolutely. Primary care is a major area of concern. It's kind of like losing your starting pitcher. But then we're also seeing shortages in these really key specialties like neurology, psychiatry, pulmonary, and critical care medicine.
So why are we benching our star players? Like what's driving all of this?
Well, one big factor, and one that's gotten a lot of attention, I think rightfully so, is physician burnout.
Yeah.
They're facing these incredibly high workloads. They've got mountains of paperwork. And then, frankly, the increasing attacks on science and government intrusion into healthcare decisions. I mean, it's a lot to deal with.
Yeah, I was reading a piece by the AMA president and some of the anecdotes about, colleagues who were actually leaving because of burnout and political pressures. It was pretty heartbreaking.
Yeah. It's a really serious issue, and the statistics are pretty alarming, too. Do you know that physicians are dying by suicide at twice the rate of the general population? That's awful. And you'd think that, they would seek help, but I can imagine it's not really that simple.
Unfortunately not. The AMA, they reported that 40% of physicians haven't actually sought mental health treatment because they're afraid that it'll affect their licensing.
It's like a catch-22. They need help, but they're afraid to actually ask for it.
It's a tough spot to be in, for sure.
It's like they're playing injured, but they can't risk going on the disabled list.
Yeah.
And then on top of that, you've got the financial strain too. I know shrinking Medicare reimbursement rates have been a big topic in the news.
Yeah, those shrinking rates, they're forcing these smaller practices to close. It's kind of like losing your farm system, the place where you develop new talent.
Right. And then you've got the high cost of medical school, which is averaging over $250,000 in debt. I mean, that's a huge signing bonus that these new grads have to pay back, with interest. And so that really pushes a lot of them towards the more lucrative specialties and leaves these essential but less glamorous positions, unfilled.
It's like everyone wants to be the home run hitter, but who's going to play left field?
Right, exactly. And then to make things even more complicated, even if we could just recruit more players right now, it still takes 10 plus years to fully train a physician. It's like waiting for a rookie to develop in the minors. But we need solutions much faster than that.
So we've got a serious problem on our hands here, and it's impacting the entire healthcare team.
Yeah.
But what about solutions? Like what's our winning strategy? How do we turn this game around?
Well, there's no magic bullet here, unfortunately. But there are a number of strategies that are, being discussed and advocated for. And just like any good game plan, it involves kind of a multifaceted approach.
Okay, so let's unpack that a little bit. First up, what about increasing residency slots? That seems like kind of a no-brainer, right? Just to get more players on the field.
Yeah, it's like expanding your farm team, right? More slots mean more opportunities to develop new talent. In fact, the AMA is actually pushing for something called the Resident Physician Shortage Reduction Act to try and do just that.
That sounds promising. So is that the solution?
Well, it's a good step in the right direction, but there's a bit of a catch. You see the funding for residency slots, it hasn't really significantly increased since 1997. So we need a lot more resources to really make a real impact. It's kind of like trying to build a winning team with a shoestring budget.
Ah, I see. So it's not just about adding the slots, it's about actually
Yeah.
investing in those training programs. So what else is on the table? What about addressing burnout?
Yeah, addressing burnout is absolutely crucial. And one idea that's being floated around is to push for legislation that reduces the administrative burdens on physicians. Let them actually focus on patient care, not paperwork.
Right. Give them more time on the field and less time in the dugout filling out forms.
Exactly. And another important step is to address the stigma around mental health. The AMA is urging states and physician employers to actually remove these stigmatizing questions about mental health history on licensing applications. Let physicians actually get the help they need without fear of repercussions.
Yeah, so it's like saying, "Hey, it's okay to take a mental health day, without getting benched."
Right.
Now, what about the financial burdens that we talked about? The massive medical school loans and the shrinking reimbursement rates.
Right. Those are huge hurdles. And there are a few ideas being, tossed around. One is loan forgiveness programs and financial incentives to try to attract talent to these underserved areas. It's kind of like offering, a signing bonus to a free agent to get them to play for a smaller market team. And the AMA is actually backing several bills that are, trying to do just that, like the Conrad 30 and the Physician Access Reauthorization Act.
Okay, so we've got boosting residency slots, tackling burnout, offering financial incentives. What other plays are in our playbook here?
Well, one strategy that's gaining traction is to kind of expand the team by utilizing advanced practice professionals, like nurse practitioners and physician assistants. They can provide a lot of the same care as physicians, especially for things like routine checkups and follow-ups.
So it's like having a strong bench to support your starting lineup.
Exactly.
Makes sense. What about telemedicine? That seems to be, gaining some traction, especially in those rural areas.
Yeah, it is. It is. Telemedicine can be a really valuable tool, especially for those medical deserts we were talking about earlier.
Yeah.
And it can really help extend the reach of physicians, especially for consultations and, those follow-up appointments. Think of it like a well-placed pinch hitter.
Right. And of course, we can't forget about the importance of diversity in the physician workforce.
Absolutely. Increasing diversity improves healthcare equity and access for, underserved communities. It's like having a team that actually reflects the community that it serves, players from all different backgrounds and experiences.
So we've got a lot of strategies that are in play here. But here's like the million-dollar question. Can technology really solve the physician shortage? I mean, all the advancements in AI and automation, it seems like technology could just, step in and fill some of these gaps.
That's a question a lot of people are asking, and it's a really complex one. I mean, it's tempting to think that technology is going to be that magic bullet, but we have to be realistic about its limitations too.
Okay.
It's important to remember that technology is just one tool, in the toolkit.
Right. It's like giving our players better equipment and training, but not replacing them with robots.
Exactly.
So where do we draw the line? How do we use this technology strategically without undermining that human element of healthcare?
That's the key question, and it's one that we'll be exploring in more depth as we continue our deep dive. I mean, technology can definitely help improve efficiency. You think about AI assisting with diagnoses, automation handling routine tasks, telemedicine, connecting patients with doctors remotely. I mean, there's
There's a lot of potential there, it seems like.
Yeah.
But you mentioned limitations. What are some of the downsides to think about here?
Well, One is that over-reliance on technology could lead to, misdiagnoses. Machines are great at crunching data, but they can't always pick up on those subtle cues that a human doctor can.
Right.
And it could also lead to, a decline in physicians' skills if they're not actively using them.
It's like relying too much on the instant replay and forgetting how to, actually play the game.
Exactly. We need to find that sweet spot, where technology enhances that human expertise, but doesn't undermine it. It's not about replacing doctors with robots. It's about giving them the tools they need to provide, the best possible care.
So technology can be a powerful pinch hitter, but it's not going to win the game on its own.
That's a great way to put it. It's about finding the right balance, using technology strategically to free up physicians' time so they can focus on what they do best, providing compassionate, personalized care.
Speaking of compassionate care, we've talked a lot about the numbers and the systems involved, but what about that human cost of this shortage? What does it mean for us, the fans in the stands, so to speak?
Yeah, that's a really crucial point. If we don't address this shortage, I mean, we're all going to feel the impact. We're talking about, longer wait times, difficulty finding doctors, especially specialists, and potentially, a decline in the quality of care that we all receive.
So it's not just about convenience, it's about people's lives.
Absolutely. Delays in care, especially for folks with chronic conditions, which are becoming, more and more common as the population ages, can have really, really serious consequences.
It's like, ignoring a minor injury that ends up sidelining you for the whole season.
Exactly. Early diagnosis and treatment are vital for so many conditions. And if we don't have enough physicians to provide that, those delays can have this huge ripple effect, impacting people's, their health and well-being for years to come.
So this isn't just a healthcare problem. It's like a societal problem.
Precisely. It impacts our economy. It impacts our workforce, our overall well-being. It's time to recognize the physician shortage for what it is, a public health crisis that demands, urgent action.
That's a sobering thought. It sounds like we're all on the same team here, and we need to, start working together to find solutions. But what can we do? We're not doctors, we're not policymakers. So what can the average person do to help turn this game around?
That's a great question. I think first and foremost, awareness is key. Talk about it. Share the information. Let your elected officials know that this issue matters to you.
So be a vocal fan. Let the team owners know that, we want a winning season.
Exactly.
What else can we do?
Well, support the organizations that are working to address this issue. The AMA is a great resource. There are other groups that are, advocating for change. Look into those organizations, see what they're doing, and consider, lending your support.
Okay, so we can educate ourselves, raise awareness and support, those who are fighting for solutions. But I'm still kind of curious about that human side of this issue. We talked a lot about the numbers and, the potential solutions. But what about the real stories, the experiences of patients and physicians who are actually living with the, consequences of this shortage every day?
Yeah, I think that's a really important point. It's easy to get lost in the statistics, but we're talking about people's lives here. We need to remember that there are patients out there who are struggling to get the care that they need, families who are facing financial hardship because of, medical bills. And of course, the physicians themselves, I mean, they're the ones on the front lines. They're the ones dealing with the stress, the burnout, the pressure to do more with less.
It's like expecting them to, pitch a no-hitter every game with the depleted bullpen.
Right, exactly.
What kind of stories are we hearing from patients?
Well, one news report highlighted a woman with, long COVID symptoms who spent months searching for a doctor who could actually help her. And by the time she finally found someone, she was saddled with this huge medical bill and her health was still suffering. And, she felt incredibly frustrated with the whole system.
It's like being stuck on the injured list with no clear path to recovery.
And that's just one story. There are, countless others out there, people who are delaying care because they can't find a doctor or they can't afford it.
It's like playing injured because you can't afford to take time off.
Right.
And we know those delays can have serious, sometimes even life-threatening consequences.
Exactly. The human cost of this shortage is immense. It's impacting everyone, from the players on the field to the fans in the stands. We need to remember that behind every statistic, there's a human face, there's a human story.
This deep dive has been really eye-opening. I feel like I've gained a much deeper understanding of this, physician shortage and its implications.
I'm glad to hear that. And I hope it inspires you to, to take action, even in a small way, to help, address this really critical issue.
Now, before we wrap things up, is there anything else from our research that kind of stood out to you?
Yes, actually. There was a report about an interesting initiative at the OSU College of Medicine. They're really focusing on encouraging young students, particularly those from underrepresented backgrounds, to consider careers in science and healthcare.
Oh, that's fantastic. Catching them young, getting them excited about these fields. I mean, that's so important.
Absolutely. It's about planting those seeds early on and showing them the possibilities.
It's like investing in the farm system, nurturing those future all-stars.
Exactly. And it's not just about, filling the pipeline. It's about creating a more diverse and representative healthcare workforce, one that reflects the communities that it serves.
Building a better team for the future.
Yeah.
I love that. So while, the current situation might look, kind of bleak, there are glimmers of hope out there. Yeah, it is encouraging, to know that people are working on these long-term solutions. They're trying to address this issue at its roots. It's like recognizing that to build a dynasty, you need more than just a strong starting lineup.
Right. You need a whole organization.
Exactly.
Yeah, it shows a commitment to building, a healthcare system that works for everyone for generations to come.
Well, this deep dive has given me a lot to think about. The physician shortage, it's a complex problem. But it's clear that, there are steps we can take. There are things that we can do to actually improve the situation.
Absolutely.
We can't just, sit in the stands and hope for the best.
Nope.
This is a game that, that we all need to kind of play a role in. So before we sign off, I wanted to share something that I found particularly interesting. We've talked a lot about technology as a potential solution, but also about, the need to kind of preserve that human element of healthcare.
Yeah, it's a tricky balance to strike.
What if, instead of just focusing on how technology can, replace physicians, what if we explore how it can help them rediscover the joy in medicine?
I like.
You know what I mean?
Yeah, I mean, what if AI could help, analyze and streamline all this tedious administrative tasks that we've been talking about,
Right.
freeing up, physicians to spend more time with their patients?
Exactly. What if telemedicine wasn't just about increasing access, but about creating more meaningful connections between doctors and patients?
Yeah.
What if technology could help us create a more humane and compassionate healthcare system, one that actually supports both patients and physicians?
Yeah, that's a really powerful idea.
I think that's a vision worth striving for. A healthcare system where technology empowers physicians to be at their best so they can deliver, the best care possible.
Yeah. A vision where everybody wins.
This has been The Deep Dive. Thanks for joining us.